Hello, my name is Matthew Iannotti. Welcome to Disability Channel. I am here in Cleveland, Ohio. I am interviewing to my Aunt Vicki from University Columbia, and she's a pediatrician working at Columbia University in New York. Hello, Auntie.
Good morning, Matt. It's so nice to be here with you.
Well, I'm happy to invite you.
Thank you. Thank you. I appreciate that very much. It's a wonderful opportunity.
Well, yeah. So I will be starting to ask some questions, if that's okay.
Absolutely.
Okay, great. So how long have you been practicing in pediatrics?
So July, it was 27 years. So,
Okay, well, okay, all right. Yeah. So I said University Columbia, or sorry, Columbia University. Am I correct?
correct. I work for Columbia University.
Okay.
Near Department of Pediatrics.
Right.
In a division, an outpatient division called Columbia Primary Care. And that's Columbia, the main hospitals are in Manhattan in New York City. And where I work is just north of that in Westchester County in Bronxville. And they have a second hospital there, New York Presbyterian Lawrence in Bronxville.
Okay. Do you practice in the city or just outside?
Just outside the city. Yeah.
Okay. Now, how did you choose pediatrics?
Yeah. So very, very long time ago in my life when I knew that I wanted to go into medicine. I was fascinated by the human body and medicine as a field. And then specifically, I really enjoyed working with children and taking care of people from when they're born, right in the nursery, all the way through college. And for 27 years, I've been very fortunate to see patients literally grow up from babies to going to school. And it's a wonderful journey.
Okay, good. In your practice, do you have any patients with disabilities?
So I do. I have many patients with many different types of disabilities. Because I do take care of people from the time they're born. Some children are born with a genetic mutation that gives them an array of disabilities, as well as, illness happens, accidents happen, and people, children that I know become disabled along the way through things such as happened to yourself.
Right. Okay.
So,
how common has the children has come to you for the disability?
Yeah. So I've come to have patients in more recent years who come to me because they know by word of mouth or, looking me up that, I've developed sort of as a, an, experientially trained specialty, taking care of kids with disabilities, taking care of kids who are nonverbal, who have syndromes or an array of difficulties, that takes a special sort of extra senses sometimes. We use everything that we learn in medical school, and then there's what's called the art of the practice of medicine, and it is an art in that it is something that you develop beyond what is what you can learn in a textbook or through learning from others. So I do have a fair number of patients who have disabilities.
Right. Okay. I don't want to put you on the spot, but could you name some disabilities?
Sure. So I have patients who have genetic disorders, some that are unnamed actually because they're pretty rare or uncommon, where they have deletion or duplications on their chromosomes that, we know that from taking their blood and having genetic studies, but since it's not a defined syndrome, as I say to the parents, we're not really sure what to expect. And so as they grow, I tell the parents, you want to be as positive and push as much in the way of their learning and development. At the same time, balance that with the fact that we know that there are problems and we know that things are going to take time. And that sometimes is the hardest thing. I do have children who have, well-known genetic defects like Down syndrome or trisomy 21, FOXG1 syndrome, comes with seizures that are intractable. And those are really difficult because, having seizures from infancy is something that really disturbs development. And, medication management is not always able to control their seizure disorders.
Yeah.
And it's a really uphill battle for the kids and for the families.
Right. Yeah, that must be difficult for you.
Well, it's sometimes some of the care that I provide is not only for the medical reason that they came in for. They may come for a checkup, and in pediatrics we give lots of immunizations, so so they may be coming in for that, and then we may get into a long discussion about all of the other stressors that are going on in the house and for the child, and nursing care in the home, and special services at school, and balancing the care of that child with their siblings who, are also impacted by having a sibling with disabilities.
Right. Okay. We're going to take a break after these questions. I'll be asking you sometime soon. So we're going to go to commercial.
Would you like to donate to our employment programs? Please follow the link below to donate through PayPal. All proceeds go to our programs.
Hi, everyone. I am Master Sergeant Retired Anna Maria Blithen and privileged to be the host of Veterans Onward to Prosperity. Each episode brings you more information, sources, and resources by which you can manage your life, live a life, and thrive in your life. So stay tuned to all of our episodes and be the best you can be.
Hello. So this is Dr. Vicki Iannotti. She's a pediatrician. She works at Columbia University. And she worked for 27 years as a pediatrician. So how difficult, I'm sorry, I lost the question. So more importantly, the question is, what's the most satisfying while you're working for pediatrics?
So the most satisfying part of my job is the interactions that I have with the children. Sometimes they're small things that happen in the day, little things. You know, children are resilient and forgiving and open. And sometimes as we go through life, you know, some of that openness and forgiveness doesn't stick with us as much as it should. I always marvel at that. And so that is very rewarding. Children seem to understand that even if they're coming to the office to see me and something, you know, that they don't want to happen is happening, either
Right.
they need lab work or immunizations or something that I'm going to help if they're sick, that needs to happen. And you know, they're screaming and kicking and crying and all the things that maybe adult doctors don't have to deal with, but in pediatrics we deal with that all the time.
Right.
You know,
Well, you're a patient. You're a patient. Well, you're seeing a patient. So,
yes.
right.
Yes. You know, you're not always the nicest, right? And so,
Absolutely.
so,
Right.
So beyond that, though, as you also know, you know, when you get past that moment, you know, and you realize that that person is there for you, doing the tough stuff to get you through because they know that that's what you need and they care and they want to get you to the other side in better health. So, you know, that is very rewarding when a patient says thank you or gives me a hug on my legs because they're not even tall enough. You know? And so, but there's all kinds of rewards. You know, I think I've had healthy people grow up as my patients and say that they want to go into medicine or they're going to be nurses or doctors, and that I had a role in that, and that is very cool.
Yeah.
And, you know, I think things like making a diagnosis that is serious and doing that early in the sense that perhaps the patient didn't really come in for that. But, you know, my sort of antenna are always up, always making sure that, that the serious stuff isn't there. And sometimes it is. And so if that is going to be something that I catch, that makes me know that my purpose is important that's rewarding.
Right. Well, I see quite often when I'm around you, seeing you holding babies, and I see quite a bit of smile, and you're enjoying around with a child. You're golden-hearted. I definitely noticed, and you are. I just, when I see your face, I see your caring and loving doctor. That is for sure.
Thank you. Thank
Yeah,
you.
absolutely.
I do count myself as lucky and blessed in many ways. And yeah, I think kids are, they have their lives in front of them. It's like a clean slate. And when, when they have disabilities and when the struggles are hard, I try to support the parents as much as I can.
Right. Well, I look at the children who have you, they're very lucky.
Thank you.
Of course. We're going to go to commercial right after this.
Hello world, it is Unstoppable Tracy with the Disability Channel inviting you to subscribe and watch live on Roku TV, on YouTube, on Restream, and also listen in Wisconsin Radio, Dave Stevens, all around the world. And on top of all of this, really proud to announce that we now also have a mobile app. So you can download for free, watch Roku TV for free, and the mobile app is free too from Google Drive. Be sure to download it and have it at your fingertips at all times. There's a job platform, and there's a live chat feature, and there's the TV feature with Roku TV, and there's also the social media channels. Take care, folks. Bye for now.
Hi, I'm Christopher Guzak from the Disability Channel. Please become a TDC ambassador today. To join, please go to www.thedisabilitychannel.ca.
This is Dr. Vicki Iannotti. This is my aunt. I'm very fortunate to have her around me. So she's a pediatric at University of Columbia, and we are discussing about her taking care of patients. And thank you so much for staying on the Disability Channel. I appreciate it. All right, you take care.